Hi, my name is Ashley and I'm one of the physios at Sydney Advanced Physio. I specialize in women's health and today I'll be talking a little bit about abdominal separation or diastasis recti. Now, your abdominal is actually a layer of 4 muscles. On top you have your rectus abdominis or your six-pack abs. Then you have your external obliques, internal obliques, which help with the rotation movements. And underneath all of that you have your transverse abdominis. Okay? These you can think of a little bit like a corset. Okay? They help to stabilize the spine and the pelvis. Now, this is the most important muscle for abdominal retraining following pregnancy. Now, everyone, men and women who never had babies, have what we call an interrecti distance. That is the space between your rectus abdominis. So that top layer, that six-pack layer, there are actually 2 muscle bellies. In the middle, there's connective tissue. Okay? The space is the bit of connective tissue. In most people, you can't feel that space much because the connective tissue is quite firm and the space is fairly small. Now, again, everyone can technically get a diastasis recti or abdominal separation. That occurs when there's a prolonged increase in intra-abdominal pressure. Now, the reason it's so common postnatally is because now, if you imagine this as the connective tissue and the deepest layer of abs, and on top you have your six-pack abs, when you're pregnant, belly stretches, okay? The rectus abdominis have to separate as a protective mechanism to allow room for the baby to grow. Now, you can also see that the connective tissue in the middle stretches quite a bit. Now, coupled with the hormonal changes during pregnancy, it does get quite soft. Now, after delivery, this happens. Now you can see that the rectus abdominis aren't sort of at that starting position. This should approximate over 3 months is where you'll see the most changes. Now what you can also notice is that the connective tissue, it's not very supportive, it's not very tense. So a key thing that I look at when I look at a diastasis assessment is to see how wide it is, how long it is, and how well you can contract your transverse abdominis, that deepest layer, in order to tense that connective tissue. This is what is going to provide support and stability. It's going to prevent back pain, prevent hernias, and it's really important in abdominal retraining postnatally. I recommend that every woman sees a women's health physio for a postnatal assessment following pregnancy to have your separation assessed so that we can give you the best exercises for your particular case.